The Built Health project in the Chinatown International District in the Seattle area has been to help us to mobilize our partner organizations who have a long and each have a deep history of working in the Chinatown International District, but doing it separately. And for the first time, they're able to come together, because Built has allowed us to do this, to work on a Chinatown International District Community Health Action Plan. There are 7 partner organizations that are working together in the Built Health Challenge. These organizations address housing development, clinic. Some serve specifically, one demographic that lives in that neighborhood. And each of these organizations have a deep and a varied history of working with the folks that they serve. But it's integrated in that for the first time, they're coming together and looking at that place as a whole and thinking, how are we going to be able to address these 4 areas that people who live here and work here say are important to them together. So it's data-driven, not just by the data assets that government has access to, but it's also data-driven with the complementary data that's provided by our local FQHC clinic. What I love about this particular project is that it's led by the community. So being able to go from, here's what the data show, here's what people have said, here's what the businesses have said, and if we think about it and look at it together, it really boils down to thinking about it asset-based wise, 4 different result areas that are bold and upstream. I think it's moved quite quickly. I'm really excited about how quickly it's moved. These folks are not, working with a community-based organization, it's very much roll up our sleeves and let's figure out what we can do to take action, instead of let's ponder and how risk averse are you, and there isn't that sense of hesitation. There's definitely a sense of urgency, but there certainly is an art, and there has to be a willingness, and there has to be the right amount of resources so that you can actually do it and do it well. I think that there's lots of key components to collaboration and lots of frameworks of, here are the best practices around collaboration. All of those are out there. It boils down to trust and figuring out how you can develop that trust with different entities.